Hi Alexia, I want to thank you for being willing to talk to other patients about your experience with Invisalign. What were your symptoms before we started, and what was your journey?
Oh wow. Well, before I got Invisalign, I was having horrible headaches. My jaws were just intense pain, really all over my face. I thought I was losing my mind. I thought I had every horrible disease known to man. I was convinced that I was going to die. I had ringing in my ears, dizziness. The dizziness would just come on me at any time when I was driving. That was the scariest thing. And it was just a horrible pain in my neck, through my shoulder, down into my fingers. My fingers were even numb. And so I was just having every possible symptom you can think of as a result of the TMJ.
And so then, did you go to medical doctors? What kind of doctors did you see, and what kind of testing did they do?
I saw my regular physician who suggested that I see a neurologist. I had my ears checked by an ENT, thinking that the pain in my ears had to be an ear infection. I went to several doctors. I even talked to a doctor about having psychological problems because I thought I was losing my mind because the pain was so intense.
Did they do any CAT scans or MRIs or anything that invasive or that expensive?
I did not have any of that done because I came to see you and you said you have TMJ, and I'm just telling you, you could spend $250,000 having all these tests run, but they're not going to find anything because you have TMJ.
Okay. So in your particular case, after you started treatment and we delivered the first set of aligners, when did you start getting relief?
The relief was immediate. I came in the morning, I was getting my, to do the workup was so painful for me because my jaws hurt so bad and everything hurt so bad. And so I came in the morning to get my first aligners and I had the worst headache in the world. It was just intense pain. And I thought, I'm going to have to go home and go back to bed because it hurts so bad. But literally, as soon as we clicked those aligners into place, there was instant relief. And I don't know if it was because we had the right pressure on the right nerves or if it was just because we were getting, I don't know what it was, but it was instant relief from headache.
That doesn't happen each time. Alexia was really lucky that you were one of the ones that got immediate relief. Some patients, it's going to take almost until the end of treatment when their bite is totally corrected before they really get that kind of a response. But we do, 90% of the time, we get major relief from headaches, dizziness, ringing in the ears. You've been so kind to talk to other patients about Invisalign and how that, even though other professionals will say Invisalign cannot treat TMJ, they're wrong. We're just ahead of the curve. Not everybody knows what's possible. Thank you so much for your help, and I'm tickled that it's helped you. In fact, it's helped you to the point that, what have you decided to do with your son?
My son is also getting, he just got him today, Invisalign. He was having some dizziness issues, and we saw his cardiologist about that. We saw an ENT about that. We saw an endocrinologist thinking that it might be related to blood sugar. He saw numerous specialists, and none of them could find anything wrong with him. And Dr. Hinkle suggested that he had TMJ and that the Invisalign might help that. And so he just got them today, and we're very hopeful that that will help the dizziness and the headaches.
And you have to think that anatomically, he's your son. He has your genetics.
That's true.
Okay, and so unfortunately, sometimes we see that it runs in a family because that jawline that was Grandpa's jawline, you know, he inherited from you.
Right.
And so that bite that might be Aunt Sue's bite and Mom's bite and your brother's bite, it's all the same. And so when that's corrected, and you know, God usually puts all the right parts together. Sometimes they need to be moved around and tweaked a little bit, and then we're going to be okay. So thanks so much. I appreciate you. Thank you for your time.
Thank you.
Thank you.